Walking along Sunset Beach toward her evening shift at 8 p.m., Nurse Ashley Green suddenly stopped when she heard screaming voices. Children's voices were coming from the ocean, fear-filled, desperate calls. Running to the shoreline, she saw two small figures struggling in the waves. 4-year-old Emma and 8-year-old Tyler had been caught in the merciless grip of a strong current. People on the beach were shouting helplessly, a few calling 911. But Ashley did something different. She stripped off her nurse uniform and dove into the cold ocean without hesitation. These panic sounds and life-or-death emergencies weren't foreign to her at all. Her hands moved automatically, tactical rescue plans forming in her mind. In the next 15 minutes, everyone on the beach would learn who Ashley Green really was, because some people wear nurse uniforms but never stay at a safe distance. Welcome to Hidden Legends. Before diving into this incredible story, tell us in the comments what city you're watching from today, and hit that subscribe button. Ashley Green was Pacific Coast Medical Center's most reliable night shift nurse. At 30 years old, she had been working at the same hospital for 3 years. She never experienced any problems during her shifts, kept patient records flawlessly, and never complained when faced with difficulties. Everyone on the team drew strength from Ashley's presence. She maintained her composure even in tense moments, solved the most complex situations, and always had the necessary equipment ready. Ashley, whose auburn hair was always practically tied in a bun, inspired confidence in patients with her gentle approach and calmed them with the softness of her voice. Her green eyes quickly analyzed every situation, and the steadiness of her hands gave her patients peace. Ashley's equipment control approach was markedly different from her colleagues. She examined every piece with military precision, reviewing emergency supplies, medical instruments, and communication equipment as if preparing for a vital operation. Sometimes others found this sensitivity excessive. "We're just nurses, Ashley, not special forces," they would joke. Ashley would smile and not respond, actually knowing that both groups were wrong. Ashley's emergency management abilities amazed even her supervisors. "Where did you learn this leadership capacity?" they would inquire. "Experience," Ashley would reply. Always vague, never going into details. And this experience came from areas completely different from ordinary nursing. Ashley Green had joined the Navy at 18. When she joined the Navy, she chose the Hospital Corpsman program. After basic military training, she was selected for advanced training. U.S. Navy Hospital Corpsman was the world's most comprehensive naval medical program. But this was just the beginning. The real specialized training was yet to come. Special Operations Combat Medic Course, an 18-month intensive training process, medical intervention in naval operations, life-saving with limited resources, underwater emergencies, underwater rescue medicine. Ashley was selected for the top 3%, and this training would be very useful on the beach that day. "A Navy corpsman isn't just a medic," said Training Commander Chief Petty Officer Rodriguez. "You're the person making life-death medical decisions in every environment. Whether you're underwater or under enemy fire, you'll keep drowning victims alive." Ashley had embraced this mentality, providing maximum medical impact under any conditions, performing surgical intervention in naval operations, combining water rescue with medical care, and medically fighting against technical constraints were her fundamental principles. The most difficult part of her training was underwater rescue medicine, emergency intervention during diving, cold water hypothermia treatment, injured rescue at sea, and having to perform medical operations with basic materials. Ashley had acquired extraordinary capabilities in these areas. On her first deployment, she was in carrier-based medical operations in the Pacific, medical operations on Navy ships, helicopter crash rescues, sea rescue medical support duties. Ashley's most critical intervention was rescuing a pilot who fell into the sea during a storm. In cold water, among high waves, she performed an operation equivalent to hypothermia and drowning treatment with only basic medical supplies. On her second deployment, she was on the Coastal Operations Medical Support Team in the Persian Gulf, medical support in amphibious landings, medical backup for underwater demolition teams, emergency interventions in coastal operations, and the techniques she acquired during these duties were methods never used in civilian life. especially multiple drowning management and water rescue medicine methods with limited equipment. Ashley had conditioned herself to work in all types of sea conditions. Cold water, high waves, limited visibility, none could prevent her medical intervention. Her reflexes had become like aquatic medical navigation systems, and these abilities would save lives on the beach that day. Her third duty was peacekeeping operations in the Mediterranean. Refugee boat rescues, medical aid for civilians stranded at sea, humanitarian water rescue missions. Ashley had now gained medical expert-level competence in all types of sea and coastal conditions. But most importantly, she had never allowed any sea situation to prevent her medical intervention. For 9 years, Ashley had successfully carried out 67 critical water rescue medical operations, never leaving any incomplete due to sea conditions. So why had she left the Navy to become a nurse? This story was more complicated. PTSD, adaptation problems, civilian life challenges. Ashley's transition hadn't been smooth. High-stress medical work felt familiar, but civilian procedures were different. And this tension would explode that day. After receiving honorable discharge in 2019, Ashley had transitioned to the civilian health sector. She had used PTSD rehabilitation, adaptation coaching, and career change support. Hospital nursing had been a perfect match. It reminded her why she became a hospital corpsman, helping people at risk. The hospital environment was stable, predictable, positive after years of naval operations. Peace was welcomed with satisfaction. When Pacific Coast Medical Center hired her, Ashley was overqualified. Nursing degree, 9 years of military medical experience, hospital corpsman certification. But the hiring panel didn't ask detailed questions. They were pleased to reach a qualified candidate. "I've always loved rescuing people at sea," Ashley had said, and this time she was completely sincere. Daily work was easy compared to naval operations, patient care, standard procedures, routine calls. But Ashley was doing much more. She examined every case from a hospital corpsman perspective. She predetermined possible water emergency scenarios. She anticipated how pediatric emergency situations might develop. "Ashley, how do you know water safety issues so well?" her colleague Rebecca would say. "I grew up by the sea," Ashley would say. "Every water emergency is educational." This experience came from 9 years of naval operations experience. That Tuesday evening, Ashley was following her normal routine before her shift began. Walking on Sunset Beach had become a ritual for her. Her night shift would start at 22:30. While walking along the beach, Ashley heard children's screams from afar. At first she thought it was normal beach activity, but the sounds were different. Panic, fear, desperation. "Help! Our children! They're drowning!" Ashley ran toward the sounds. A family on the beach was shouting helplessly, mother, father, and other children. About 40 meters offshore, 2 children were struggling with the waves. Ashley assessed the situation. 2 children, strong current, no shore rescue equipment, Coast Guard response minimum 15 minutes. "Call 911! Request Coast Guard!" Ashley shouted to the family. 2 children drowning, offshore current. Ashley stripped off her nurse uniform and entered the ocean because these emergency water rescue scenarios weren't foreign to her. When she first reached Tyler, the situation was much more serious. The 8-year-old was trying to hold Emma, but both were drowning. Tyler's grip was weakening. Emma was completely unconscious. "Tyler, I'm a nurse. I'm going to help you and Emma." Ashley tried to calm Tyler, but the child was panicking. His body temperature was starting to drop. Motor functions were being affected. "Emma's not breathing," Tyler screamed. "She's not moving." Ashley quickly checked Tyler. The child was in shock but alive. Emma was in much more critical condition. No visible chest movement, lips turning blue. Ashley applied a special technique to Tyler, water stabilization maneuver from Navy hospital corpsman training. She lifted Tyler's chin to open his airway, gave short, powerful breaths. "Tyler, take deep breaths. I'm here. You're safe," Ashley said in a calm but authoritative voice. Tyler recovered after a few seconds. He was breathing, his eyes focused. "What happened to Emma?" Tyler asked fearfully. "I'm going to save Emma. You just hold on to me and swim." Ashley placed Tyler's hand on her shoulder. Ashley took Emma into rescue position. This technique wasn't just from civilian lifeguard training, but from Special Navy Hospital Corpsman underwater rescue protocol. Ashley began swimming rapidly toward shore with Tyler. Tyler helped by holding onto Ashley's shoulder. He was a strong swimmer and had recovered. "Tyler, you're doing great. Shore is very close," Ashley said encouragingly. Ashley was simultaneously monitoring Emma's condition. The child's pulse was very weak. She wasn't breathing. Body temperature was dropping rapidly. While swimming toward shore, Ashley was doing complex rescue coordination, holding Emma in medical transport position with one hand, swimming with the other, also controlling Tyler. "Ashley, is Emma sleeping?" Tyler asked worriedly. "Emma is very sick, Tyler. But I'm going to save her," Ashley guaranteed with a firm tone. As they approached shore, Ashley noticed Emma's condition was getting even worse. Lips dark blue, body temperature critically low. Emergency intervention was needed. When they reached shore, Ashley immediately placed Emma in emergency recovery position. Tyler was safe, exhausted, but stable. Emma required critical medical intervention. "Someone call 911!" Ashley shouted to the family with command voice. "Pediatric drowning victim, severe hypothermia, emergency advanced life support needed." Ashley quickly assessed Emma's condition. Severe hypothermia, significant water aspiration, cardiac instability, neurological complication risk. Emergency intervention was needed, but the ambulance hadn't arrived yet. Ashley began CPR. But this wasn't standard CPR. This was specialized pediatric cold water drowning resuscitation, precisely calculated chest compressions for 4-year-old physiology, rescue breathing adjusted for potential lung damage, cardiac monitoring techniques for hypothermic patients. This level of expertise could only come from advanced military medical training. Ashley examined Emma's condition. Water aspiration was serious, respiratory system in complicated condition. She would apply special techniques from Navy Hospital Corpsman training. Ashley began emergency pediatric resuscitation procedure for Emma. Her 9-year Navy Hospital Corpsman training kicked in. Underwater medical rescue, hypothermic resuscitation, pediatric advanced life support techniques. People on the beach watched in amazement. This was professional-level naval rescue medicine. Tyler's father, Michael, approached in panic. "Will she be okay?" Ashley looked up while continuing CPR. "Sir, Emma has experienced severe hypothermia and water aspiration. I'm providing advanced life support. She's fighting and I'm not going to lose her." "Ma'am, this looks like professional medical intervention. Where did you learn this?" Ashley paused briefly while checking Emma's pulse. She had to break 3 years of civilian identity. "I have special training," Ashley simply replied, continuing resuscitation. For 12 minutes, Ashley performed continuous resuscitation. Advanced cardiac life support techniques, special military protocols, life-saving methods learned from Navy Hospital Corpsman. The mother on the beach looked helplessly. 12 minutes is too long, maybe ... "No," Ashley said with determination. "I won't lose Emma." Navy Hospital Corpsman training had taught her, never give up, maximum effort, continue until resource exhaustion. In the 13th minute, Emma's heart began beating again. She opened her eyes, coughed. "Oh my God," Michael said. "How did you do it?" Paramedics arrived 8 minutes later. Advanced life support ambulance, pediatric equipment. "Ma'am, we'll take over," the lead paramedic said. 2 pediatric drowning victims, 4-year-old female unconscious, hypothermic, compromised airway. I've maintained airway patency, provided rescue breathing, monitored vitals. Current status, conscious, stable breathing, warming. 8-year-old male conscious, mild hypothermia, emotional trauma. The paramedics looked at each other in amazement. This report was professional level. "Ma'am, what's your medical background?" the paramedic asked. "Registered nurse," Ashley replied. "Your assessment was extremely thorough. Special training?" Ashley hesitated. "Military medical..." "Which branch?" "Navy Hospital Corpsman." The lead paramedic stopped and looked at Ashley with respect. "How long?" 12 years, 3 deployments, Special Operations Water Rescue Medical Support. The paramedic nodded. "That explains everything. Your patient care was textbook perfect." At Pacific Coast Medical Center Emergency Department, Dr. Sarah, attending physician, began reviewing the cases. Who provided initial treatment for these pediatric drowning cases? Beach rescue by civilian nurse, military background, the paramedic reported. Dr. Sarah looked at the medical charts and froze. This is extraordinary. Advanced pediatric resuscitation, hypothermia management, complex airway procedures. This is combat medic level care. Ashley was quietly in the waiting room, but Dr. Sarah's next question would reveal everything. Which medical professional provided this level of care? The paramedic indicated Ashley. Ashley finally decided to tell the truth. I did, ma'am. This is specialized water rescue medicine. Where did you train? Ashley took a deep breath. U.S. Navy Special Operations Hospital Corpsman Program, underwater medical specialist, 9 years active duty. Complete silence, and at that moment everything made sense. Dr. Sarah was amazed. Our nurse is a retired Special Operations Hospital Corpsman. Not just hospital corpsman, advanced water rescue medicine, pediatric drowning response, multi-casualty marine incidents. Rebecca and David were realizing, but the real shock hadn't come yet. Dr. Sarah's next question would put everything into perspective. What was your military rank? Petty Officer First Class, Combat Medical Specialist. Even Dr. Sarah was impressed. Petty Officer, your water rescue medical experience surpasses most of our emergency staff. Ashley was modest. Different context, doctor. I'm a nurse now. But Dr. Sarah's next offer would change Ashley's life. Petty Officer Green, would you consider joining our pediatric emergency department? Ashley was surprised. I'm not civilian pediatric emergency certified. We can arrange that. Your experience, your skills, we need them. Emma and Tyler's families visited Ashley. Ashley, said Emma's father, Michael, we can't thank you enough. Emma has completely recovered. I just did my job, Ashley replied. You mentioned Navy Hospital Corpsman. Can you tell us more? Ashley was uncomfortable with the attention. I served 9 years, medical specialist, Afghanistan, Iraq, Mediterranean, specialized in water rescue operations. Michael was stunned. You're saying our children's rescuer is a retired Navy Special Operations medic? I'm saying I'm qualified to handle water emergencies, Ashley replied. That's what matters. So now I ask you, have you ever met someone like Ashley? A healthcare worker whose military background you didn't know, who you only saw as a gentle caregiver? Write their name in the comments. Tell us their story, because here at Hidden Legends, we believe the most powerful protectors often serve in the most caring roles. If this story touched you, share it, subscribe, and help these important stories continue. See you in the next legend. And until then, remember, your healthcare provider might be someone who's already saved more lives than you'll ever know. Service takes many forms, sometimes combat gear, sometimes hospital scrubs. Real heroes don't stop serving. They just find new places to serve.